What then do we do? Because if we keep on like this, it's clear our health system at a point will fall to its knees if it's not there already. You go to most of our hospitals, you must engage in some form of corruption, else even getting blood, getting a bed, you will not get it. Last year, someone was in need. I had to go speak, do all kinds of things. It is crazy what is going on. We have seen vaccine shortages. I've never seen it in my life. Vaccine shortages for children. Children in this country. Not once. I don't even know what the situation is now. What then, Dr. Nawaane, my final bit to you before I move on to my other guests. What then do you feel you as legislators can do and we as a people ought to do to change the script?
Yes. I remember when this vaccine shortage came, that is especially when there was a business outbreak because of vaccine shortage in the northern part of the country. I made a statement on the floor of Parliament. I tried to let the media get on top of it. And for some time, I believe that we made some progress. But the issue of some of these fundamental things, or like vaccine, fundamental things like vaccine, not being available in our country, it's a shame. It's a shame. That is why I'm saying that we are simply not prioritizing right. We have some amount of counterpart funding that was supposed to provide to ensure that we get all these vaccines in their numbers, that's as a country. But in terms of funding, it's mostly donor funded. It's mostly donor funded. This counterpart funding, I mean, it will surprise you to know that our government is not always able to provide. And that is all I'm telling you that, look, let us not look anywhere. You can blame the politicians, you can blame the technocrats, but as a nation, we should be on top of issues. We should let things happen before we come back and do a postmortem. What we are doing now is like a postmortem. Most of the issues we are discussing, they happen. We are supposed to be on top and discuss the issue before they descend on us. And one bad thing about what is happening in the country is that when things are being discussed in Parliament, a lot of these civil societies and other things appear to be mute on them at the time that we are discussing them in Parliament. The minority do not have the numbers, but they bring out the issues. Now, it is up to civil society. It is up to the press. It is up to the National House of Chiefs. It is up to the state society to join Parliament at that point to try to do the right thing. But when these issues are brought up and we don't join Parliament to change the situation there, and it goes into the budget. For example, we are not talking of ECG 15%. All these things were stated in the budget. When the minority were rejecting them, nobody spoke about it. Now it is an issue which has been picked up by the trade union organizations. Where were they when these issues were being discussed in Parliament?
Right.
Let us get our the people will say that when the issues are not being discussed and trying to become a policy, trying to become a law, at that point we should all resist. If it means that we should even go on demonstrations, fine. Let us resist at that point. But we'll wait. When the thing now it becomes like a law, now they are being trying to implement it.
So you're saying the way forward is let's hold our leaders accountable before there's a mess. Look at the Public Accounts Committee, for example. Sometimes you only see things after the fact. You are calling for demonstrations. I hope that if your administration comes to power again, if they do, and people also demonstrate on these same points, you will not feel hard done by.
no,
on them?
during the NDC era, I believe that, these things were, the civil society and other organizations, they were really very hard on NDC.
Right.
I don't know what has happened now,
Okay.
but they were really very hard. And I think it was positive. Yes.
All right.
It was positive. All these things are positive things. We encourage people to demonstrate it.
All right.
That, to ensure that we get things right.
Dr. Nawaane, thank you so much for your time, and we wish you the best in your constituency.